Welcome to the Lyster Health Talks podcast. Listen in as the team focuses on relevant, relatable health content that empowers your health and the readiness of the force. We are officially clearing the runway for a special mini-series dedicated entirely to aviation medicine. Over the next few episodes, we're diving into the critical role aviation medicine plays in keeping our pilots and crews mission ready and showing you exactly how our care keeps you in the air. Let's prep for takeoff as we talk aviation medicine here at Fort Rucker, the home of Army Aviation.
Welcome to the Aviation Medicine mini-series from Lyster Health Talks. I'm Lieutenant Colonel Leah Steder, the Director and Commander of Lyster Army Health Clinic and the host of the Lyster Health Talks podcast. In this aviation medicine mini-series, we'll sit down with experts. Together, we're going to discuss topics that impact readiness, performance, and the long-term health of our aviation force. Welcome back, everyone. Today, we're going to be talking about how to book a flight physical. Oftentimes, as probably many aviators or personnel in flight status have found, is there are some nuances when it comes to aviation medicine and flight physicals that aren't necessarily the same way that you would book just a primary care appointment, even if a flight surgeon is your primary care manager. Today, I'm lucky enough to be joined by Liz Johnson-Bailey.
Hi, I'm Liz Johnson-Bailey. I'm an aerospace medicine physician assistant.
Ms. Johnson-Bailey, can you walk us through a little bit about how to book a flight physical specifically, or what is the process?
Okay, so if you are applying to aviation, the first decision to be made is, are you applying to be a warrant officer or an officer? There's a 1A physical and a 1W physical. W is for warrant, A is for officer. Officers are people who have completed college or they're going through officer candidate school. W is a applicant who may have been in high school or had some college, but they're going to go through warrant officer training. They have two different application pathways. The physicals are similar, but they go to different boards. And so if you come in, when you call to make that appointment, you need to let the clerk know, I am applying to be an officer, commissioned officer, or I'm going to apply to be a warrant officer. Most of the time, the warrant officers do have a recruiter that sends them here for that. That may not always be the case. If you are enlisted, most of those people tend to be going for a warrant officer packet. You can let them know that. For enlisted personnel who are going for a crew member physical, you need to let us know if it's what class of crew member. Are you going to be a flight medic? Are you going to be a mechanic? We need to know what is the job you are seeking so we can put you in the right class of physical. If you're an air traffic controller or a UAS operator, those things matter. You don't have to know the class, but you have to tell us what the job is that you're seeking so we can make sure you're booked in the right physical. If you don't have the right physical, your physical will be disqualified once it gets over to AMA because it's the wrong class. You will call to make an appointment. At Lyster, that number is 1-800-261-7193. Tell them I need to book a flight physical for Part 1. And when you come in for the Part 1, make sure you have that information with you. If you have previously had a flight physical, you're doing an annual physical. You'll do that during your birth month. If you've missed your birth month for some reason, be prepared for additional information to be needed. If you wear glasses, make sure you bring your glasses to that appointment. You can't do a vision screening without your eyewear. Do not wear contact lenses to that appointment. We need your glasses. If you have had a physical in the past, you may want to bring your last copy of your physical so that we can have all of the information from your last physical so you can update your medical record. If you are already established in aviation, you want to go ahead and get yourself Aero Self-Service Access. That is where you as a service member can access your flight physical records in the Aero database, which is where all your flight physicals and waiver letters are held. That's at aero.health.mil. You will need a CAC-enabled computer to get that access. If you're an applicant to find out, hey, is my physical qualified yet? Hey, where do I get my letters for any copies of waiver letters? Oh, I need a copy of my stamped physical. All of those documents are in that database.
That's excellent information. You mentioned enlisted soldiers. I'm assuming you're talking about folks that are already enlisted that are trying to do an MOS reclassification or become a warrant officer?
Yes.
Do folks that are joining the Army do flight physicals before they ship to basic training?
So if they are enlisted joining to become an aviation
operator.
or UAS or ATC, they will have their physicals done at their AIT station.
Perfect.
And another nuance too, if you are at Rucker for flight school, like you've just completed walks, those physicals are not booked through our 800 number. Those are booked through the flight school themselves. They will put you on a list and you will come over and they batch you. You do not have to call over here to schedule that appointment. The schoolhouse will tell us when you are coming over.
That's excellent news. There's a new MOS for enlisted that's called 15 X-ray. They do not require, it might be misnomers right now. Right now, they do not require flight physicals.
At this time, no.
You said a lot of things. Oftentimes, even seasoned aviators forget items when they come to an appointment, but you mentioned glasses. Are there some other items that folks should have with them?
If
when
they
come to the
have
appointment?
completed a specialty evaluation for a waiver requirement, they should bring copies of that letter from that offsite provider, any offsite records that they know that they're going to need. For example, if they have a requirement that they see a GI specialist every year, bring that letter with them. If they have cardiology notes, bring those letters with them.
Now, can you kind of describe a little bit about how, I know we've talked a little bit about it, but can everything be done in one day, or are there different levels of appointments that need to be done, such as a part 1 and a part 2?
Typically, for non-flight students, we do a part 1 and a part 2. In rare instances, we can do a short physical same day. It is generally not done unless it's a rare occasion. And that is a person who has no waivers and perfect health. And we're actually even exploring some cases that there can be done virtual visits. That is a newer pilot project right now. Pilot as in new project, not as in a aviator pilot.
I know you mentioned waivers. So one of the common mistakes I see, at least at Lyster, is personnel will book their part 2 flight physical right when they're done with part 1, but might not be ready to do their part 2. Can you elaborate upon what that looks like a little bit?
Okay, so for physicals, you have a qualified physical or a disqualified physical. So say you didn't meet a medical standard and you are disqualified. That doesn't necessarily mean you won't become a pilot. It means that there may be a waiver process. For example, if you have hypothyroidism, which is a condition where your thyroid hormones are low, and you get medication, and that brings you up to our normal thyroid level, and we've reduced any risk of an aeromedical event that could be incapacitating, you can request a waiver. You're under the care of a specialist, your levels have normalized. We say, okay, you're corrected. We will give you are disqualified with a waiver to continue with aviation. The waiver has a requirement every year that you have lab work done. As long as your lab work shows that you're in a normal level, you can continue that waiver. So you have to do that as part of your physical. Some waivers will require maybe you have an evaluation with a specialist every year. So that's the biggest difference on why some physicals cannot be done in one day. You may have to go off post to a specialist. It may be a specialist that's a higher demand specialist or harder to find, a non-local specialist. Some people may have testing that has to be done every year. Maybe you have an eye condition that's not something an optometrist sees, it's an ophthalmologist sees it, and they're off-site, and you have to do some special eye tests every year. Those are the things that you have to have done between the part 1 and the part 2 for us to be able to complete your physical.
Perfect. Now, we've talked about this a few of our other episodes, but flight surgeons are not the final approval, so it goes to a different area to be approved, and waivers often require specialists to approve those waivers in addition. But obviously, a lot of our listeners are probably interested in how they can track the status of their flight physical.
Okay, so I did mention the aero.health.mil site. That is where your information for your flight physical is tracked. Now, as a user, it doesn't give you a whole lot of information. It'll say in progress, in progress. Mm-hmm. Your flight surgeon has the most information. Does it help you to message your flight surgeon every week? Hey, what's the status of my waiver? Not really, because waivers don't move quickly. What helps is knowing, has my waiver been requested? First of all, have I done everything I needed to do for my waiver? Your flight surgeon has what's called aeromedical policy letters for most conditions, and that is the checklist of what's required for each condition in order to request a waiver. If I have this condition, I have to do these 8 things, and those evaluations have to come back, and then my flight surgeon can write a medical synopsis that says, yes, all of these things have been done, and the condition is stable, we recommend a waiver. That synopsis is sent electronically to AMA. It is coded by a coder, It is reviewed by a reviewer who agrees or disagrees with the flight surgeon's recommendation. They put some additional data into it. It then goes to a ACAP, which is a board with maybe pilots, other providers. It may be a specialist in that field of medicine. If it's a blood condition, it's a hematologist. If it's a brain condition, it's a neurologist. And maybe an SP or an IP of that type of airframe. And the director of AMA. They meet collectively. What is the risk of this condition having an event? What is it? What's the likelihood of getting maybe the 10 years out of this aviator's condition? What's the risk of putting this person in the aviation field and the condition progressing? All of those factors are taken into account and an ACAP is held. Then, a vote's taken, yes or no. Then it goes to, if it's National Guard, to the National Guard person who votes. Active duty goes to HRC. If the waiver is approved, a letter comes back to AMA and is posted in the Aero database, and it goes back to the flight surgeon to let you know you've got your waiver. The waiver letter also will have what your annual waiver requirements are for your physical. And so that process can take, depending on if we have to consult with a specialist, it can take several months.
No, thank you so much. And that's where I do think it's important for our listeners to understand, if they are new, to really allow 6+ months for a flight physical. You've mentioned the word AMA a few times. Can you kind of describe, I know AMA is the one that approves or disapproves flight physicals, but can you kind of describe what they do or who they are?
So AMA is the Army Aeromedical Authority. It is the governing body for Army Aviation. They write the standards, and we are the regulatory body for aviation medicine.
Perfect. I also think it's important for our listeners to understand that while they are stationed on Fort Rucker, they are a separate entity from Lyster Army Health Clinic.
I
know
are.
that gets
also,
confusing sometimes.
What's interesting about AMA is we also have the Aeromedical Epidemiology database of all conditions from the beginning of aviation. So if someone were to ask, how many waivers have we given for low back pain for rated aviators? We can pull up and give a count of how many aviators we've had and how many years have they had waivers for things. Somebody said this morning, how many waivers have we given for this bleeding disorder? Mm-hmm. And that database pulls all of that information. And so we can determine statistics and how many people have flown with this for how long.
Oh, that's amazing. I did not know that database existed.
And basically, it's about mitigating aeromedical risk to less than 0.5%, that this condition can cause an in-flight event that can be catastrophic.
Right, and I think that's important too for folks to understand is everyone operating the aircraft does carry a lot of risk in general because they have cargo in the back, and oftentimes that cargo is human.
Or even on the ground.
Yes.
It's not only the people in the aircraft, it's people under the aircraft. It's everything.
And I've found too that folks that are approving really do try to get to yes if risk can be mitigated.
It's about the risk.
So, before we wrap up today's episode, do you have any final thoughts you want to leave our listeners with?
That we're partners. We're partners in medicine, whether we work at a clinic and we're a flight surgeon, whether you're a patient, whether we work at AMA and we review work of others, that it's a partnership.
Perfect. And I think it's just also important for, and you've said it now in multiple episodes, is remember your birth month.
Don't forget your birthday.
And book early. And until next time, this is Lyster Army Health Talks.
And that wraps up another episode of our Aviation Medicine mini-series on Lyster Health Talks. Stay healthy, Fort Rucker.